local healthcare team is now on their way to Kenya to help patients there with blood disorders. News 8's Lakin McGee spoke with some of the doctors and is here with the story. Lakin, what did they tell you about this mission?
Well, Hannah, we do know that there's more people in Kenya dealing with rare blood disorders there than here in the United States, and we have easier access to healthcare while they don't. So the team going is at the Indiana Hemophilia and Thrombosis Center. They left yesterday and will be gone for 2 weeks to a city in Kenya called Eldoret. Dr. Anthony Bedbedel says this is his 5th trip there. He says it's easier to diagnose men than women. Bleeding disorders can cause long-term disabilities and even death.
We're now trying to collaborate with the OBGYN group in Eldoret to try and screen women for bleeding disorders, to try and find those that have bleeding disorders.
He says hemophilia and sickle cell is the ones they see the most. So sickle cell is fairly common. In the U.S., it affects 1 in 500 people, while in Kenya, it's 1 in 200. Stacey Akins is also going. She's a physical therapist and says people with hemophilia bleed into their joints.
Our primary goal at the beginning was education, not only for our Kenyan team, but then to be able to go out, like Dr. Bedbedel said, to other areas to provide that education because people just didn't know about hemophilia at all.
She's been going since 2012 to help the folks there. It is estimated that more than 4,000 people in Kenya have been born with hemophilia, yet with the lack of appropriate care, less than 1,000 have been receiving treatment. So that is why they're going over there, hoping to identify more people, educate them, and provide those resources. I'm Lakin McGee for Wish TV, wishtv.com, and like us on Facebook.